Conventional cancer treatments such as radiation, surgery, and chemotherapy are not cures. According to research in a medical article put out by Health Impact News in October 2015, authored by John Thomas, more cancer patients die from conventional methods because they simply do not work before cancer has a chance to claim the life of the sufferer. Sometimes patients plead with their doctors for alternative options, so the doctors will prescribe placebos, which are pathologically useless and are designed to deceive the patient. Unfortunately, doctors say the same thing about homeopathic remedies and holistic treatments to treat and cure cancer. They claim that these alternative cancer treatments are nothing more than a placebo or just complementary treatment. Also, despite billions of dollars pumped into the cancer treatment industry, the average insurance policy will not pay all of it. They'll pay only in part and limit what drug therapies can be used. Research suggests, however, that more cancer patients seek alternative cancer methods over conventional treatments because the alternative methods have been proven to have fewer recurrence of cancer, they are more effective long-term, and the approaches are cost-effective. The purpose of this presentation to inform people about alternative cancer treatments available, which the U.S. government and the Food and Drug Association and big pharmaceutical companies have banned from being practiced. This information, as reported in September 2015 by U.S. News correspondent Michelle Andrews, is meant to persuade people to research options for cancer treatments rather than taking the doctor's word as gospel or letting the insurance companies dictate what types of treatments they will pay for. The central idea is to advocate for a proactive push for legislation which allows for these treatments to be available, to regulate the cost of these treatments, and to mandate the insurance companies cover those costs for alternative treatments. By empowering patients with knowledge, they can face their doctors with confidence regarding alternative integrative cancer treatments, take more control of their health care, and in doing so, government, and more importantly, big pharmaceutical, cannot dictate what medicines patients ought to take when overwhelming evidence prove and drug companies advertise disclaimers of the ill effects and harms their drugs cause, including death. Chemotherapy can weaken natural defenses. This will hinder recovery times from surgery. Conferring with Dr. Kenneth Lyles from Duke University Medical Center and the National Comprehensive Cancer Network in 2014, most times the effects are not immediate for the conventional treatments, but will show up later, such as nausea, vomiting, extreme weight loss, fatigue, hair loss, anemia, and weak bones, such as osteoporosis. Research provided by Mike Adams of Biotech Limited 2014 shows that GC macrophage activating factor, GCMAF, is the human protein that keeps us cancer-free. Radiation and chemotherapy treatments destroy this protein, which is a natural occurring compound in our bodies. GCMAF has 20 effects on our body, 6 of which fight cancer. 6. Once this enzyme is destroyed, the body's natural defense against cancer is gone. Tragically, most immunotherapies used in other parts of the world are banned in America because they are considered an unapproved drug, because they cannot be tested and the results cannot be regulated. In 2015, Dr. Ernesto Contreras Sr. of Oasis of Hope in Mexico describes one way American doctors fight cancer using low oxygen, known as hypoxia. Tumors need blood vessels to grow. Anti-angiogenesis is a form of depleting blood cells to cancerous tumors, causing them to die. The theory is that the cancer cells would become defenseless against radiation without the oxygen to feed it. But some cancers become resistant to this method and become more inimical if oxygen deprived, meaning the cells can mutate and spread elsewhere in the body. The American Cancer Society in 2015 accurately portrayed how a cost-efficacy process was to obtain the desired results, a cure for cancer, from the lab to the direct use and its expenses. Even then, when one drug is used solely or integrated with other treatments, another drug comes along, thereby making the former treatment less effective. Then the medical and regulatory systems deem the older drug is no longer productive, and the insurance companies won't cover it. The structure of the DNA has been known for less than 100 years. Even less quantitative is how conventional cancer treatments work or do not work within that structure. However, herbal medicine has been used for centuries with proven success to treat a myriad of ailments, conditions, and diseases. Health Society journalist Elizabeth Renter wrote an article in 2015 on the Chinese use of an aquatic animal known as the sea cucumber to cure cancer and activate a dormant immune system. According to DrugWatch.com, a team of scientists at Oxford University, the cost of conventional cancer treatments are astronomical. In 2007, the cost for conventional treatments was $219.2 billion and are said to be short-term effective. In 2010, that amount will have increased over 19%, and it was estimated that by 2020 it will increase to over 28%. Some of the costs that we're looking at here, initial visits in 2010 were just over 40,000. In 2020, they're estimated to be over 48,000, and soaring up to over 61,000. And the last cycle of treatment will be $48,000. On chemotherapy, just chemotherapy alone, 1 month is over $10,000, 6 months is almost $50,000, and 12 months over $66,800 for just office visits. Hospital outpatient department estimates that 1 month is almost $14,000 for treatment, over $61,000 for 6 months of treatment, and 12 months over $100,000. The U.S. Department of Medicaid reports office and hospital outpatient department costs for 1 month alone is equivalent to the federal poverty levels for 1 year's gross income, 1 month at $10,764 in 2015. Even with those numbers, finance consultant Jay McDonald at Bankrate.com states that insurance companies tell you which conventional treatments they will cover as well as limit the amount that they will pay, and the rest is patient out-of-pocket expenses. Chris Elkins, also of DrugWatch.com, states Bristol Myers Squibb will charge $141,000 for the first 12 weeks of